time this evening, live with an update on the COVID-19 coronavirus here in the United States. I am a retired New York City police detective, 20 plus years in the New York City Police Department. I am also living in New York, right outside of New York City, in the most heavily populated new cases of coronavirus in New York. Thank you for joining. Please remember to hit the subscribe button, hit your notification bell, and subscribe, all one word, DutyRon, on YouTube, Facebook, Instagram, and Twitter. All one word, DutyRon. Yilfa, good to see you. Thank you for joining. Angela, ATF, Meg Lowe, Brenda, Beth B. Higgs, Just Believe, Bridget Parker, all the great good friends and family of the DutyRon. Thank you so much for joining. Please share out onto your live stream. Retired Irish Detective, Erica Collins. Great to see you, Erica. How have you been? Guys, do I have good audio, or are we still in the crapper on the audio? Is everything good? Trevor JP, can I get a thumbs up on the audio? Last time we had a little technology disadvantage. I was disadvantaged on the technology scale. So I'm hoping that we were able to recover. Nancy Drew, thank you for joining. Sleeping Beauty, welcome to all my channel members, my Patreon supporters, and all the people who subscribe and leave comments. I greatly, greatly appreciate you. I hope that each and every one of you are faring well in your country, in your state. I hope everyone is staying safe and heeding the warnings of your local government, your local police department. Meg Lowe, I know Harvey Weinstein got coronavirus and he deserves that and much, much more. Good riddance to Harvey Weinstein. I hope his coronavirus does justice on him. Amanda Costa, the rock star, good to see you. Coffee with Michael B. Maxine, Michelle Poirier, thank you so much. Winky Whispers, Dawny Colors, MJ Doris, Sleeping Beauty, Linda Halcrow, all the way from Australia. Wait a minute. Linda Halcrow is, Bridget Parker's in Australia. Linda is in New Zealand. Kia ora. Good to see you. Thank you for joining. Joy Sumter, great to have you. Thank you, Jesse Miller's Unboxing. Jesse Miller Unboxing. Appreciate you, Froggy. Frog Push Eye on Weather. I like calling her Froggy. She's great. Tabitha Tilly, thank you so much. Guys, I'm going to show you a really grim figure. I'm going to show you a real grim number and a grim figure. Let me just situate my desk the right way here. This figure that I'm about to show you is alarming to say the least. This is going to be the total confirmed number of coronavirus cases. And there you have it, a staggering 332,577 confirmed cases worldwide. Now that is a number that in itself is shocking. Hello from Long Island, Lola Torres. Thank you so much for joining the live stream. I appreciate you being in here. It's Mother's Day in the UK. Happy Mother's Day to all the great mothers out there. Honey Badger, thank you for joining. So here we have it, 14,450 confirmed total deaths, 97,875 recoveries. That's a good number. I'd love to see that number go up higher. Gemma's Journey, Grace, thank you for the super chat. I appreciate that. Respect and love. Love you, DutyRon. Respect and love from the UK. Thank you so much for that. These are figures that I want to show you guys for a good reason. The reason I have these numbers up here, and this is coming straight to you from Johns Hopkins University. These are legit numbers. This is not any bullcrap fluffed numbers. These are legit numbers. They're actually probably much higher on the confirmed area here because so many people have it or have had it, and then it took its course and got through their body and they survived. And undocumented, I would have to say there's a good, it would be a guess, but there's a good probably 150 to another 150,000 extra cases that were undocumented because they didn't have the testing available throughout the world, not the United States, throughout the world. I would have to say that this number is probably closer to 500,000 right now, if I had to guess. And it could be higher. It could be higher. Where is Australia and New Zealand on the map? It's over here. I'd have to take the map and drag it over here. Hold on. It's over here. Stand by. There's Australia. There's Australia right there. And New Zealand is over here, right? I think I'd have to zoom in. Whoa. Linda, you're killing me. Where is it? Indonesia. Okay, so you get the idea. Let me get it back over here. Hold on a second. Hold on. Let's look at Africa and the UK and France, Norway. We'll go all over the world here. Taipei, Japan. I'm all over the place. There we are. Thank you, Linda. All right, let me get it centered because I have to show you the figures for New York. Okay, as you all know, DutyRon resides in the state of New York. Okay, we are looking at the figures for Italy, which is a total of almost 60,000 confirmed cases. The death toll and the number of cases in Italy are soaring at an alarming pace. And the reason I'm bringing these things up is not to instill fear or create any anxiety for anybody. I want you guys to understand the reason why the President of the United States and all of your elected officials and leaders throughout the world are telling us to self-quarantine or limit our social interaction because of the rapid way this is spreading. And that is the only reason why they're telling us there's a stay-in order and there's, don't go outside, limit your contact with the public. They're telling us this, and, don't send your kids to the playground on a nice day like people are doing in New York City. Don't do that because this is how things get spread. And I'm showing you these figures. Here's the United States, 33,276 cases, 417 deaths, and 178 recovered in New York City. I'm telling you about this because I want you guys to understand that the reason why our governments and our elected officials throughout the world are telling you to wash your hands and use the precautions. Don't go outside unless you have to get necessities like food, water, gas for your car. You can go out and walk around, but don't congregate with people because of the way this is spreading. The way this is spreading is just, it's like wildfire. And they're trying to, they say cut off the curb or, curb the curve. Listen, all of that bullshit means nothing to me. At the end of the day, the way you can get this virus is by human contact or by touching surfaces that have this virus that's living on it. So at the end of the day, washing your hands, I'm now washing my hands 50 or more times a day. I'm taking precautions, and that's the things that our elected officials want us to do. Inner Peas, thank you so much for coming. Thank you for everyone joining. I'm not looking at the chat because I'm trying to get my point across. Let's look at some of the figures in Spain. 28,000 confirmed cases, 1,700 total deaths, 2,575 recoveries. I like to see those recovery numbers high. Germany has lower, it looks like 23,974 in Germany, 92 deaths and 266 recoveries, and so on and so forth. We go over to France with 14,000 and almost 500 confirmed cases, total deaths 562, souls who are deceased from this virus, 2,200 recovered, and then it goes on and on. The UK has 5,736 confirmed, 282 on the deaths, and 67 recoveries. Switzerland, 7,200, 45, 98. Netherlands, my good friends in the Netherlands, 4,200 cases. So you guys can go and see this for yourselves. It just goes on and on down the line. Canada's got some low numbers, which is good. Japan, Brazil, Ireland has some low numbers, and it just keeps going down and down and down as we scroll through the countries. I want you guys to listen quickly to a press conference that was from today, but let me just say hello. Let me get myself back on the video. Hello, everybody. I am here. I'm just trying to show you some. Some figures, and the figures are purposely shown to you by me, not to instill fear, but to show you the urgency of social distancing, the urgency of washing your hands if you come in contact. Keep that 6 foot distance, and you should all be very safe. If you keep the 6 foot distance, I feel each and every one of us will be safe. Paul Peck Drywall, thank you so much for being in here. There is no need to panic and get over anxious about this. We are sheltering in our homes to stop the virus from spreading, but this will pass with time. Look at China. We thought China was going to be wiped off the map. If we would have talked about China in January, all of us would have said, oh my God, everyone's going to die there, right? But look, you're now into the month of March, and there's no more cases in China. They're not popping up like wildfire because the spread has stopped. Okay, we have the United States and the federal government is involved in speeding up the tests. No longer do you have to get just solely the swab up the nose test. There's an immediate test that they just approved that they're putting out. The president just spoke about it. They have activated the National Guard for the state of California and state of New York, and I believe 1 or 2 other states. The National Guard, ladies and gentlemen, is not for martial law. They are there to help build medical facilities, to help put together their resources. They're there to put together medical emergency help. So those of you who are freaking out about, oh my God, the National Guard is being activated, the military is going to be here, they're not here to kill us. They're here to help us. Okay, our military not only protects us from enemies, foreign and domestic, they're there to help us in times of need like this. So that's what's going on. The Boss Dundee, welcome in, my good friend. Thank you, Rouse Trucking, and all the great ones that are in here. So let me give you quickly what the New York governor has said today. I just want you guys to hear a little bit, a couple of snippets from Mario Cuomo. That's the New York State governor. I want you guys to hear just a tad bit of what he had to say. I'll put on this full second display. This is just a short clip. 2 clips. We'll show you this one, and I'll do it on warp speed for you. Sorry, guys. I apologize.
This is no time to play politics.
We got sound now, right?
And we need our congressional delegation to stand up and to fight for New York. Also on the federal role.
Hey, Glara, thanks for joining. Sorry
I'm
about the no
requesting
sound.
today from the federal government that the Army Corps immediately proceed to erect temporary hospitals. I went out yesterday, I surveyed the sites. There are several good options that give us regional coverage. An Army Corps temporary hospital at Stony Brook, which is on Long Island, Westbury, which is on Long Island, Westchester, where we have that terrible cluster, which is, thank goodness, reducing, and the Javits Center, which is a very large convention center in Manhattan, in New York. And New York City is obviously where we have the highest number of cases. I met with the Army Corps. They've reviewed these sites. I approve it. I approve it on behalf of the state of New York, and now we just have to get it done and get it done quickly. These temporary hospitals are helpful, but they don't bring supplies and they don't bring staff. And that compounds our problem of not having enough medical supplies, and frankly compounds our problem of not having enough medical staff because we are trying to increase the capacity in our existing hospitals. The sites that we picked allow for indoor assembly of these facilities, so they won't be out of doors. They'll be indoors. Some places we may need to do them outdoors, but these campuses also have dormitories where the healthcare staff can stay. They're very large, there's space, and again, I have made all necessary approvals. So from my point of view, construction can start tomorrow. These are pictures of the places where we would assemble them in Stony Brook, Old Westbury, Westchester County Center in Westchester, all indoor locations, all open, all ready, accessible. Jacobs Javits Center, we just expanded it. It's one of the largest convention centers in the country. It's open, it is ready to go. There is no red tape on the side of New York.
Okay, so look at this. The FEMA will erect 4 federal hospitals at the Jacob Javits Center. This is what he's proposing. This is not necessarily what's going to happen. He's asking for 250. That's 1,000 total with those 4 quadrants of 4 federal hospitals. They'll be fully functional. And the reason that he's requesting this for New York is because we have the highest cluster of cases. As I showed the graph to you guys, we're up close, approaching 15,000 cases in New York. So this number is going to soar as the days go on, and Governor Cuomo knows that we are going to have an unbelievable amount of cases here. We don't know what it will be. At the end of the day, folks, it's going to be more, the more testing that's done, the more tests that happen, the more positives you're going to get. So that's what's going on, and that is the reason why everybody is really conveying a message of social distancing, keeping yourself safe by taking unnecessary precautions, washing your hands, not rubbing your eyes. The eyes, the nose, the mouth, the ears are the most common places of infection with the coronavirus, just so you know. He is definitely well-spoken, and he's taken charge for the state of New York. And I'm going to play the governor of New Jersey, and we'll let you hear what he has to say.
Also asking FEMA to come in, Federal Emergency Management Agency, to come in and erect 4 federal hospitals at the Javits Center. The federal hospital by FEMA is different than the Army Corps of Engineer temporary facility. The FEMA hospitals come with staff and with supplies. They're in 250 bed configurations. We're asking for 4 of those 250 bed configurations to be assembled in the Javits Center. The Javits Center can easily manage them. It's in the heart of Manhattan. They're fully equipped, they're fully staffed. Again, we are.
Okay, again, you know, the reason that this is happening, hello to everyone coming in. Crafty Cottages Creates, thank you so much. Kitty Love, thank you for being in here. The Glara, thank you so much for coming in. Linda Halcrow, thank you for telling me where New Zealand is. I knew it was by Australia, I just couldn't find it. I tried to zoom in and I couldn't see it. Call me old or call me whatever you want. I missed it, but I know where New Zealand is. My good friend you and Bridget Parker are from New Zealand. Louise Poppy, Bridget Parker, Australia. Katina, good to see you. Thank you so much for being in here. All right, let me get up the next graphic. Let me give you to the next thing I want to show you. I won't show you de Blasio because I can't even stand the sight of that guy. He's just so he's such a crybaby, and he really sucks at managing the city. I'm not going to show you de Blasio. I do have him up here on the queue. Here's New Jersey Governor Murphy. I like this guy a lot. I really like this guy a lot. He's awesome. So let's take a peek at him. Let's take a peek at New Jersey's governor. He's awesome. Yes, I know it's
We can no longer maintain a sense of business as usual during this emergency. And again, I repeat, just as it is no time to panic, but it is. I signed an executive order directing nearly all of our 9 million residents to quite simply stay at home. We can no longer maintain a sense of business as usual during this emergency.
This
and
was
again,
from
I
yesterday,
repeat,
but then he'll
just
show
as
stuff
it is
from
no
today.
time to panic, but it is time to be smart, proactive, transparent, aggressive. It is also no time for business as usual.
New Jersey Governor Phil Murphy announcing a stay-at-home order yesterday prohibiting social gatherings and closing all non-essential businesses. And Governor Murphy joins me now. Governor, what finally made you tell your residents they have to stay home?
Martha, we've been trying to get out ahead of this. We first started meeting on it in January. We formed a whole of government task force, I think, on Super Bowl Sunday, February 2nd. So at every step of the way, we've been trying to get out ahead of this. And it's quite clear that unless we crack the back on the social distancing side, on that curve that we're flattening the curve that we're talking about, we're going to have an overwhelming amount of pressure in our healthcare system. So,
okay, when he says pressure on the healthcare system, he's meaning tons and tons of more new cases and tons of more sick people that our healthcare system is not equipped. It's not a mass unit where it can handle hundreds of thousands of patients. So this is the problem that we have in America. We have hospitals, but they're not equipped to be quarantined and sectioned off for a very contagious virus like this. These aren't just regular patients that are coming into the hospital. They need to be quarantined in a part of the hospital where there's nobody else. So that's what makes this a difficult situation. And the men and women on the front lines, the nurses, the aides, the doctors, the cleaners, the people who work in the hospitals, they are on the front lines. And I tip my cap to them and I salute the healthcare workers, the ambulance workers, the technicians, the police officers, the firemen, the ambulance drivers, and everybody along the lines. They're the ones that are fighting this fight. And they are facing this virus and with no fear. I gotta give them props. These people all throughout the world are fearless warriors because they are treating patients knowing that they will get sick. 100 New York City police officers have the coronavirus. 100 of our police officers in New York City are now being treated for coronavirus, and some of them are in the hospital. And that number will soar. That number will rise. So at the end of the day, folks, the first responders, the firemen, the nurses, the doctors, the EMTs, the technicians, the people who clean, all of the people on the front lines in the healthcare industry are the heroes here. And, you know, you got to give them props because I've always said that these are the people who are there to help save lives, and they're risking their lives and their families. They're risking taking this virus home to their families.
These extra steps, we've been taking them all along. My plea with folks in New Jersey is, frankly, just stay home. Unless you're essential, unless you're helping us in the fight, we need you to be at home, and we need you even at home to social distance.
And give us a sense of what's happening on the ground there now.
Listen, we're, I think, the fourth state in terms of number of positive cases. As of yesterday, 1,327 positives, 16 fatalities, God rest their souls. Our testing regime is expanding dramatically. We now will open up our second drive-through testing on Monday. That's good news. So the numbers are going up partly because we're confirming the data. And that will allow us, as you all know, to better and more proactively deal with this awful crisis. But folks needed to be jolted. You mentioned in the tape, it's no time to panic, but just the same, it's no time for business as usual.
Okay, that's a statement that we all should listen to this. It's no time to panic, but it's definitely not a time for business as usual. Life as we knew it a month ago here in the United States is over, you know, and it's only over temporarily. You have to watch what you're doing. You have to be real aware of what you touch. Like today, I took my wife she went to go food shopping. We brought the Lysol wipes. She wiped down the carts. Some of the food stores have a person there that's wiping down every cart, and they're only letting in a certain amount of people to come in. But these are precautions that weren't in place in December or January or even in February. And now we're living a little differently, and it's for a good reason. It's for a good reason. Thank you, Black Rose. I appreciate that. Linda Halcrow, thank you so much for being in here. Expedition Greg, great to see you. Channel member and a good friend of mine. Everyone subscribe. Expedition Greg. Maui Michelle, thank you for letting me know about the muting with the super chat. Thank you for sending the super chat, and that got my attention. So everybody, the hero of this live stream is Maui Michelle. She sent me a super chat to tell me that the stream was muted. So thank you for that, Maui Michelle. Awesome, awesome. You get the hero of the live stream.
We won World War II not because we panicked. We were smart. We were aggressive. We worked hard. That's what we're going to need right now.
The New Jersey health commissioner who's leading the war against the virus is essentially saying, said in an interview, that everybody in New Jersey is going to get the virus, and yet you are having non-essential businesses close. So what would you say to those businesses who are closing if the commissioner thinks everyone is going to get it anyway?
Excellent, Katina.
Yeah, listen, we've got an extraordinary commissioner, Judy Persicelli, the first nurse ever to serve in that position in New Jersey. My view is we die trying. I think the flattening of the curve, the social distancing, telling everybody just stay home gives us a real shot to keep the numbers down, to keep the pressure lesser than it otherwise would be
Kindness, Kate,
on our
my pleasure.
healthcare system. And that will, God willing, save lives, have fewer sick folks. We're not sitting on our hands, by the way. We're also working with the Army Corps to expand our healthcare capacity. But
really
my
like
view
this
is,
guy.
and I think the
He's
health
doing a
commissioner
great job
joins
for New
me, the
Jersey.
more aggressive we are on the front end and social distancing, the better a shot we have on the back end of keeping more people alive and safe.
And Governor, the Congress and the White House are finalizing a package to address the economic and the health challenges created by this virus. What's the greatest need for your state right now?
So we've got a couple of things. We are desperate for more PPE equipment, personal protective equipment.
Yes.
We've had a big ask into the strategic stockpile in the White House. They've given us a fraction of our ask. We are, as a state, private sector, public sector, nonprofits, turning over every stone. But we need a lot more PPE, both to protect our healthcare workers and to treat the sick. And then secondly, the economic impact is overwhelming for workers, for small businesses. We need the federal government, we need Congress and the president to send direct cash assistance. We think New Jersey, New York, Pennsylvania, Connecticut alone, those 4 states, need $100 billion direct cash assistance to allow us to continue the fight. And I'd say lastly, there's a cost share between the feds and states of 75-25. We'd love to see that go to 100 for the feds, take the pressure completely off of states. So those are 3 specific asks. That
Governor,
I want
to ask you very quickly, if you wouldn't mind, because we want to speak to some other governors. What was your reaction to what the FEMA director said? You said you still need those masks.
We sure do. We've had a good working relationship. Actually, FEMA Region 2 has been very good with us this week, setting up.
All right, so that was New Jersey's governor, Phil Murphy. He's a good man. He's taken charge for the people he represents. And listen, all the governors throughout the United States, this live stream is primarily, I can only base my knowledge on the United States. I don't know what goes on in other countries, but I do read about what's going on. And I know that there is, good men and women who are in charge in the different countries that are trying to do the best that they can. Don't forget, this is something that we've uncharted waters. We've never had a battle, a virus like this on a national level and on a worldwide level. So everyone has to take into consideration these are just human beings that are answering this pandemic the best way they know how, and there's no playbook for this. There is no playbook. So when we look at this and we start saying, well, why aren't they doing this? Why aren't they doing that? Why aren't they doing this? Why aren't they? You have to understand that this is an enormous operation that is not just something you can just snap your fingers and get things going. It takes a lot of resources to get these things going. So we're going to hope and pray for the best case scenario and hope that we can get ahead of this curve, as they say, and to try to get this to level off. But we need us as Americans and people of the world, all the citizens of the world, we need everyone to stay calm and stay educated. Educate yourself on keeping yourself and other people from being infected. And by practicing all of the safety measures that are being told on the cdc.gov and on all the different various legit websites, you can educate yourself and keep yourself and your family safe. Because remember, if you get sick and take this home, you're going to infect everybody in your whole household or in your whole family. So that's what we have to stay focused on. Let me show you one last thing, and then we will take some questions and answers. I think this is what I wanted to show you. Nope, that's not it. Stand by. Why can't I find the things that I want?
This is no time to play politics. Okay. And we need our congressional delegation to stand up and to fight for New York. Also on the federal role.
All right, here we go. It's not that one. This is it. I got it. I got it now. Okay. I just want you guys to hear, and I'm going to ask you kindly, no matter what your feelings are towards the president, this is not a political thing. This is no time to spew hatred or, nasty comments about anybody. Let's just listen to this. It's just a minute long. This is our president from just moments ago. Let's hear what he has to say, and let's all be decent people about this. And I just don't want to have to delete anybody. So let's listen to this. You ready, guys? It's only a minute or so. This is about the deployment of the National Guard.
Today I'm announcing action to help New York, California, and Washington ensure that the National Guard can effectively respond to this crisis. The National Guard, these are tremendous people. They're fully on alert. We've signed what we had to sign, and it's been activated. We're dealing also with other states. These states have been hit the hardest. Actually, pretty much by far, you could say the hardest. Everybody can see that. Just look at the numbers. And through FEMA, the federal government will be funding 100% of the cost of deploying National Guard units to carry out approved missions to stop the virus while those governors remain in command. So the governors locally are going to be in command, and will be following them, and we hope they can do the job, and I think they will. I spoke with all three of the governors today.
That is not true.
And
just
a
please
little while
refrain
ago,
from that. I'm not trying to get anybody panicked
what we're
here.
going to be doing, because we'll be announcing some other things for those three states and some other states where it's hit the hardest.
Okay, let me just say what I said before, because there's a couple of people who are new or just joining. Enacting the National Guard is not martial law. National Guard and military troops are going to be here to set up medical facilities and to aid the people who get sick. When you have a pandemic and you have tens of thousands of people who are getting sick, you need to have your military and your National Guard on call. So activating them is a proactive step taken by the powers that be, the President of the United States, and it is by all means not anything remotely close to martial law. I just want everyone to understand that there's a lot of women, there's a lot of men, there's a lot of people who live home alone and that are scared. And I'm in no way, shape, or form going to want to have any kind of instill any kind of fear in anybody. That is not going to happen here. These men and women of our National Guard and our military are here to protect and help us get better. And they're here to help in the aid of rendering medical attention to the sick who contract the coronavirus. And that's simply all it is. I know this for a fact. I know from being in law enforcement for 20 years. I know this to be true. If I didn't think it was true, I would tell you guys. I will be the first to tell you if I feel that there's a reason to be concerned. I won't hold back on that. I can tell you that. Anybody that knows me here will tell you that I'm not going to hold back if I feel that everyone needs to watch out. That's not the case. We're nowhere near that, and it's not going to happen.
This action will give them maximum flexibility to use the Guard against the virus without having to worry about costs or liability, and freeing up state resources to protect the health and safety of the people in their state where it's hit the hardest. This action will give them maximum flexibility to use the Guard against the virus without having to worry about costs or liability, and freeing up state resources to protect the health and safety of the people in their state.
So like he just said, they're there to help to protect the freedom and safety and health care of the sick and injured, the people who become ill from this virus. And that's all they're being mobilized for. They're going to erect tents and pop-up hospitals and treatment facilities throughout the United States. He talked about New York, California, and Washington. Those are the 3 states that will see the National Guard, and they'll be there to help assist in the medical attention for everybody. So don't get yourself up in arms over this. I'm going to play Cuomo
When you
now.
increase the number of tests, you're going to increase the number of people who test positive.
Yeah, I just said
and
that.
the numbers show exactly that. We have now tested 6.
So these numbers are these numbers are pretty staggering. These are numbers throughout the state. New York City, 26,000 tests, 6,927 new tests as of yesterday. So out of those 6,927 new tests, you're going to get some positives. Westchester, 10,000, and then there's 2,011. Nassau County, there's a county that I live in, 6,171 total tests, 1,968 positives. So these are some of the figures that they're looking at. The more people you test, the more positives you're going to get.
61,000 people. Newly tested, 15,000 people. So these numbers just are exponential to what is being done anywhere else in the country. And that's why you're going to see much higher numbers than anywhere else.
So you can see the numbers.
Total number of new cases, 15,000. I'm sorry, total number of cases, 15,000. Total number of new cases, 4,800 new cases. You see the state, more and more counties. We're just down to a handful of counties now where we don't have existing cases. As I said, that is going to be 100% covered. It's just a matter of time. On the hospitalization rate, which is a number that I watch very closely, it's 1,900 cases out of 15,000, 13%. 13% is actually lower than it has been. We've been running at 15%, 16%.
Okay, so 1,974 out of 15,168 tests. So they conducted 15,168 tests, 1,974 tested positive, 13% positive rate. So, a high negative rate on those tests. Meglo, that was a very nice statement you made. I can't go live all day long. You know that. I'm always available on DM, and you know the deal. We have an open line of communication. So 67 confirmed positive in New Zealand. 2 have not been overseas, so they got it in New Zealand. Yeah, it's difficult. It's difficult. We're going to get through this, folks. We are going to get through this. No worries.
Percent as high as 20%. This is 13%. This is the key indicator because this is saying how many people are going to come into your healthcare system as the number goes up. So this is
So you see the
not
graph.
bad news.
Stay home, stop the spread, save
Across
lives.
the country, you see New York now has 15,000 cases. Washington State, 1,600, California, 1,500. So we have roughly 15 times the number of cases.
So we have here in New York 15 times the cases in Washington and California and New Jersey. State of Michigan down very low, 786, and then it just keeps going down in the other states right there. So this is a pretty detailed press conference.
In terms of playgrounds,
I have to do it.
this is a thorny issue, and I'm saying this as a parent.
people.
I used to take
Hold on.
my kids
Before I say this, this is an answer. This is de Blasio. This is the mayor of the city of New York. This is de Blasio's, and again, hold the negative comments about him, please. Let's be better humans. De Blasio is directly doing this news conference right here today. This was today because the governor, Governor Cuomo, told him he's doing a shitty job at keeping the people out of the parks in the city. And Joey Brooklyn, if you're here, you can testify to this, that The parks are packed with people, kids playing like there's nothing going on. And Cuomo made a statement. I'm going to play it right after this, but this is his response to Cuomo. This is his baby response to Cuomo. Here we go.
In terms of playgrounds, this is a thorny issue, and I'm saying this as a parent. I used to take my kids to playgrounds around Prospect Park in Brooklyn constantly. I understand a lot about the culture of our playgrounds and the challenges that we deal with in normal times with all the kids who want to be on the playground. Here's what we're going to do for this next week. And I'm only saying this for this next week because we want to try it out. We're going to say to parents, look, here's the reality. If you're going to go on a playground, you have to take full responsibility for the situation. Full personal responsibility. Here are some of the realities. We cannot have overcrowding on a playground. If there are some people already on the playground, it's starting to get so you can't keep 6 feet away from.
Let me tell you what's going on in my community. You guys saw my live stream from yesterday in Valley Stream. I was at the park. The playground is roped off. You can't go in it. There's a sign up in Nassau County. It says playground closed. De Blasio, all he has to do is close every playground and the problem is solved. Put up crime scene tape, do whatever you got to do, shut it down. He is suggesting for a week we try out playing in the nice. Play nice. If you see too many people, leave. That's hogwash. This guy is a complete and utter joke.
From people who are not part of your family, don't go on the playground. If our police, our parks enforcement officers, or other enforcement agents see a playground that's starting to fill up, they're going to clear it out. If you go to the playground,
So make the police
you need to keep
the playground?
your children away from
Shut it
children who are
down.
not part of your family. That's your responsibility. We will always do our best with city enforcement, but we can't be everywhere, obviously. You have to take responsibility. If you don't feel you can do it, don't go to the playground. Some parents have said, will the playgrounds be cleaned and sanitized? The answer, just a real blunt New York City answer, is no. They never have.
Okay, I got to get off of this because this guy's nauseating. I can't listen anymore. I know I told everybody to be nice, but I just can't. I can't. I want to listen to Cuomo talk about how ridiculous everybody is in the city, and I don't know where the hell it is. I had saved a statement. Where is it? Hold on. I think it's here. I think this is it. Hold on, it's below this. Fungal. That's not it. All right, I can't find it, but Cuomo basically slams New York City and says, what are you people doing? This is not a joke. This is not a joke. Oh, here it is. Here it is. I found it. Yay. Here we go.
And New York Governor Andrew Cuomo held a briefing this morning on the
Race that's raising prices higher and higher should benefit from the corporate at Stony Brook, which is on Long Island. By that emergency declaration, funding for these services can get the coronavirus. That is limited by the number of ventilators. What makes an ICU bed an ICU bed in this case? It's that the ICU bed has a ventilator. And that's where we get back to needing the ventilators desperately, so we have those ICU beds. We're putting out a Department of Health emergency order to hospitals that says we're not just asking you to do this. It wouldn't just be a nice thing. I'm not just asking you as governor as a civic obligation. This is a law.
Wow.
That
That's
the
unbelievable,
hospitals
MMA.
must come up with
Let's
a plan
listen to this for a minute, though.
to increase capacity, a minimum of 50. That is wholly
Here we go.
inappropriate.
Here it is.
Young people can get it, underlying illnesses.
Hold on.
And we're doing this in
All right, listen to this,
facilities
guys.
all across the state. Two different facts. I want to make sure we're clear just so there's no confusion. Fact one, young people can get the coronavirus. They are wrong when they say they can't get it. They can get it. 18 to 49-year-olds represent 53% of the total cases in New York. This is not China. This is not South Korea on the theory that, well, I'm an American youth and therefore I have a superior immune system than China or South Korea. No, that theory is not correct. In New York, 53% of the cases, 18 to 49 years old. Second fact, older people and those with compromised immune system, underlying illnesses, can die from the coronavirus. You're right, the 18 to 49-year-old is
That's a very
probably not
strong
lethal,
possibility. But let's finish
you
listening
can
to this,
get
and
it,
I'll answer the questions.
and you can get
it's
sick.
going on. People are sick, and
And
they're not
it's
saying
a
anything.
nasty
and that's very, very
illness, and
wrong
then you
to do
can
that.
transfer to someone else. That's the case for young people. Older people, obviously, if you're a vulnerable person, it can be lethal. Both facts are true, and both facts have to be understood. Young people can get it, you will get sick, you probably won't die, but you can transfer it to someone who may very well die. And you can transfer it even inadvertently without knowing you're doing it. You can touch a surface, walk away. A day later, someone can sit at this table and put their hand in the same place and contract the virus. I was in New York City yesterday. It was a pretty day. There is a density level in New York City that is wholly inappropriate. You would think there was nothing going on in parts of New York City. You would think it was just a bright, sunny Saturday. I don't know what I'm saying that people don't get. I'm normally accused of being overly blunt and direct. And I take that. It's true. I don't know what they're not understanding. This is not life as usual. None of this is life as usual. And this kind of density, we talk about social distancing. I was in these parks. You would not know that anything was going on.
Wow, Bridget.
This is just a mistake. It's a mistake. It's insensitive. It's arrogant. It's self-destructive. It's disrespectful to other people. And it has to stop, and it has to stop now.
Okay, what he's saying is so true. And this brings up what someone mentioned in the chat. If you're sick, you have a sore throat, you have a fever, you don't feel good, and you go to work, I mean, even if you're a healthcare worker, that is so disrespectful to other people's lives. That is not good. If you are sick and you are one of the essentials that have to work at a pharmacy, don't go to work. Stay home. There's somebody else that could do your job. But so Mayor de Blasio made his press conference in response to this. This was today at 11 a.m. De Blasio's was at 3. He made that press conference at 3 because his boss, the New York State governor, told him, get a hold of your people. And Joey, you confirmed it with me on Friday that the parks were jam-packed, or Saturday, yesterday. So this guy is giving him the business.
This is not a joke, and I am not kidding. We spoke with the mayor of the city of New York and the speaker of the city council, Corey Johnson. I told both of them that this is a problem in New York City. It's especially a problem in New York City parks. New York City must develop an immediate plan to correct this situation. I want a plan that we can review in 24 hours so that we can approve it. There are many options. You have much less traffic in New York City because non-essential workers aren't going to work. Get creative. Open streets to reduce the density. You want to go for a walk? God bless you. You want to go for a run? God bless you. But let's open streets, let's open space, That's where people should be, in open space areas, not in dense locations. There is no group activity in
Doris,
parks.
It
That is
shouldn't-
not the...
This shouldn't give you anxiety. This is basically the mayor of the state of New York, where there's the most cases, telling people, go out in open spaces. It's safe to do that. But don't go in places where there's people online at a grocery store. Like our grocery stores are letting X amount of people in, and then they're holding up the rest, and everyone has to wait outside, just like they're doing in Italy. And those are the ways, if you see a grocery store that you want to shop at that has hundreds of people in it and there's a big long line, don't go in there. Go somewhere else. Get whatever you have to get somewhere else. So I'm saying everyone needs to use their head and be smart. The only way you can catch this virus is by having someone spray their spit into your face, into your mouth, into your nose, into your eyes, or you rub a surface that has it on it and then rub your own eyes or put your finger up your nose or put your finger in your mouth, put your finger in your ear. Capiche? Does everybody understand that? So there's no reason to get crazy about it. This is going to pass. It's going to go away. And even if a reasonably healthy person contracts the coronavirus, you're not going to die. You're going to fight it off and you're going to be okay. It's people that are really should use total extreme precaution and probably not go out, or people who have the underlying conditions, diabetes, asthma, low immune system, cancer. Go to cdc.gov and look at the people who, if you're a healthy person and you're not sickly, you will, if you God forbid get it, you will live to tell the tale. Trust me. I had the urban explorer from the UK who's 36 years old. He contracted it. It took 10 days and he was fine. So please, people, I beg you, don't get overwhelmed about it. Don't get yourself hopped up about it. Just be careful. That's all. Just be careful. It's going to be, by the time the summer comes, we're going to be talking about this and saying we survived the coronavirus scare. So don't worry.
Point. We spoke about it the other day. All sorts of kids playing basketball yesterday. I play basketball. There's no concept of social distancing while playing basketball. It doesn't exist. You can't stay 6 feet away from a person playing basketball. You can, but then you're a lousy basketball player and you're going to lose. You just cannot do that. We also have bigger parks in New York City. We opened Shirley Chisholm Park in Brooklyn, 400 acres. Van Cortlandt Park. There are big parks. There are big spaces. That's where you want to be. But we need a plan from New York City. I want it in 24 hours because this is a significant problem that has to be corrected. In terms of numbers, I said yesterday, New York is testing more people than any state in the country, and per capita more than any country on the globe.
There she is, Mrs. DutyRon.
That is
First time in a chat.
Positive
She's on
accomplishment.
YouTube.
Pardon
Everybody
the
say
pun.
hello to Mrs. DutyRon.
Because we want testing.
Watch
We
out.
want more testing. We ramped up very quickly. We're doing it better than anyone else. And that is a good thing, because when you identify a positive, then you can isolate that person. And that's exactly what we're trying to do. When you increase the number of tests, you're going to increase the number of people who test positive. And the numbers show exactly that. We have now tested 61,000 people. Newly tested 15,000 people. So these numbers just are exponential to what is being done anywhere else in the country. And that's why you're going to see much higher numbers than anywhere else. Total number of new cases, 15,000. I'm sorry, total number of cases, 15,000. Total number of new cases, 4,800 new cases. You see the state, more and more counties. We're just down to a handful of counties now where we don't have existing cases. As I said, that is going to be 100% covered. It's just a matter of time. On the hospitalization rate, which is a number that I watch very closely, it's 1,900 cases out of 15,000, 13%. 13% is actually lower than it has been. We've been running at 15%, 16%, as high as 20%. This is 13%. This is the key indicator because this is saying how many people are going to come into your healthcare system as the number goes up. So this is not bad news. Across the country, you see New York now has 15,000 cases, Washington State 1,600, California 1,500. So we have roughly 15 times the number of cases. Now, do we really have 15 times the number of cases?
Listen here.
You don't know. We're testing much more than anyone else. So that is a major factor in this. But I have no doubt that we have more cases. We have more density. We have more people from other countries who come to New York than many other states. So I have no reason to believe.
Okay, folks. So, again, we do have the most density in New York. It's the most heavily populated city in the world. New York City is a melting pot of all different people from all different walks of life and races. And, you know, every immigrant comes to New York, comes through New York City. So that's why there's so many more cases there. And we knew that that was going to happen. Again, I just want to say thank you to each and every one of you who left Super Chat, who leave the positive interaction. If you're not subscribed, please subscribe to DutyRon. Follow me on Twitter, Instagram, and Facebook, all one word, DutyRon. Thank you to my moderators. Thank you to all my Patreon supporters and all the great people who become channel members here in the DutyRon family. I love and respect you all. I know we are going to get through this. I promise you guys, we are going to look back on this and we're going to say we got through it. So stay safe, use the necessary precautions, keep yourself protected, keep yourself safe, check in on your loved ones, check in on your neighbors by phone, keep that social distance, keep the distance between you and another person. If someone's not in your face talking, you're in safety. You're in a safety zone. So keep that 6-foot distance and you will be fine. You can go out and get groceries. You can get coffee. You can get whatever you need. You can go in your car and get a drive. We've got this. We are going to be fine. So let me just say much love and respect from the New York City area, the epicenter where all it's going down. I am right in the hot spot with Joey Brooklyn and a couple of other people here from New York. We are going to be fine. And like I said, today I showed you 2 days in a row, I went out to the park and I did a broadcast just to show you guys that it is safe to go out. If it was not safe to go out, I would not be out. I didn't survive 20 plus years in the highest crime area responding to the World Trade Center attack on September 11th. I didn't do all of that stuff and survive it to get killed by a coronavirus. So if I felt it was dangerous to be outside, I wouldn't have gone out. So I did those videos for a purpose, to show you guys that life is not over. We're not prisoners in our own home. You can go out, but you have to do it safely. Things are different. It's not the way it used to be. So again, love and respect. Thank you for joining. Thank you for the super chats. Thank you for the continuing conversation in the comment section. And may God bless America. May God bless the whole world. Everyone stay safe, and I'll see you on the next live. Love and respect from my house to yours. Thank you, guys. Thank you.